Hello, we did our project on cystic fibrosis. I am Caitlin, and then Savannah and Emma helped on this project as well. So what is cystic fibrosis? It is an inherited disorder that causes disruptions to the lungs, digestive system, and other organ systems. So basically what it does is that it affects the bodily secretions that are produced, such as sweat, mucus, and digestive fluids. It basically causes these secretions to become really thick and sticky. So in this image below, this is like the example in the lungs. You can see what a normal lung would look like, and then what it looks like if you have cystic fibrosis. So that's the one with the thick green mucus. Yeah. So the way it impacts nutrition, these thick secretions block the passageway for digestive enzymes, which travel from the pancreas to the small intestine, which causes the small intestine unable to absorb all the nutrients from the foods. Some ways that nutrition is changed with people with cystic fibrosis is that they are usually required to eat higher calories, higher like protein intake. Usually they take multivitamins, specifically vitamin A, D, E, K, and calcium. They also are required to take pancreatic enzymes to help absorb the fats and proteins that aren't broken down in the small intestine due to the thick secretions. And also it's suggested that they add salt to their meals. And in this photo here, you can see this is more of the like digestive impact from cystic fibrosis, just like the clogged up pancreatic duct, which affects all the enzymes and stuff traveling to the small intestine. So eating patterns with cystic fibrosis, typically they encourage people to eat when they are hungry, and to have multiple small snacks throughout the day. Usually these snacks need to be like cheese, crackers, trail mix, something that holds a high nutritious value. Try to maintain regular eating habits. So like, breakfast, snack, lunch, snack, dinner, something like that. Usually they have supplements like shakes and snacks that have like high calories and high protein. And then just be flexible with your hunger. So that's kind of with the whole snacking routine. So these are some tips on how to increase your calories with cystic fibrosis. So just using whole milk when cooking, adding cheese to any entrees, using peanut butter as a dip with vegetables or fruit to get in extra calories and protein, adding skim milk powder to whole milk to increase protein. So that's something which is interesting, but just to get, more protein and more calories. Adding the teaspoon of butter to hot foods, using sour cream or yogurt as dip, breading proteins rather than like grilling them, adding extra protein such as boiled eggs and cottage cheese to meals. And then this image is just kind of what it would look like for a child with cystic fibrosis, how their like breakfast plate would look. So you see that they have added in cheese, some fruit, scrambled eggs. On their toast, they added lots of butter and jelly. And then they have the supplement, I guess you could say, of the carnation instant and whole milk for more calories and nutrients. And then they got all their vitamins and supplements and stuff on the side.
Okay, so for this slide, we talk about the impacts of physical activity that CF has on people. So CF affects many different parts of the body, such as the lungs, the bones, CF-related diabetes, the digestive system, fertility, liver, and salt and sweat levels. So kind of diving deeper into that. So CF typically in the lungs can cause infections, and that can reduct lung function, which can have a huge impact on health and well-being for a CF patient. And then CF in the bones may become thinner and weaker at a younger age than if a person who didn't have CF, their bones would be more strong and less likely to break. Cystic fibrosis related diabetes. So inflammation and scarring of the pancreas can prevent the effective production of insulin, resulting in CF related diabetes. So CF in the digestive system can cause various problems with digesting food and such things like that, requiring medication, sometimes including insulin, to be taken with every meal, as well as a special dietary adjustment, such as Caitlin just said. CF also can cause infertility for men and women if they have it. And then cystic fibrosis in the liver is caused by a blockage of a small duct in the liver, which can eventually lead to liver diseases. And then CF in salt and sweat. So CF affects the movement of the salt and water in and out of cells, which can lead to salty sweat and skin for people with the condition. So as you see, CF can affect many different parts of the body and can affect people differently. But the main thing I think CF kind of like points to is the lungs. And so lungs within the CF can cause shortness of breath, and this has a limiting exercise impact. So although physical activity might be limited for CF patients, exercise can be also very beneficial for them. So my first bullet point is about specifically the lungs. So physical activity can help balance the pulmonary function. So the pulmonary function is just a test that a lot of CF patients go through to see how well their lungs are working. And so if that is balanced, then typically their lungs are working well, and this will allow for sputum clearance. And then sputum, if you don't know what sputum is that saliva mucus mixture that gets caught in the lungs in many CF patients. So sputum clearance happens when there is a combination of hyperventilation, mechanical vibration, coughing, and this changes. So when this happens, it changes the sputum rheology. So then this allows for possible buildup of respiratory muscles, which eventually and hopefully will allow for more ability to exercise in the future. So physical activity, if you have CF that's in the lungs, is super important. So we really want to like kind of focus on getting those respiratory muscles strong and healthy again, like an average person, so that you are able to go outside, take a jog, walk, bike, and do like kind of those common basic exercises. My second one dives into diabetes with CF. So physical activity can also help with this. It helps improve glycemic controls in type 1 diabetes. So your glycemic controls is your blood and glucose levels. Typically, those are imbalanced in diabetic patients. And then this also, physical activity, also improves insulin sensitivity and reduces systemic inflammation. And then lastly, physical activity has shown to delay osteoporosis. So osteoporosis causes bones to become weak and brittle. So this prevents kind of the reduction of that. So it helps kind of like build up your muscles so that they can be strong and so they won't break as easily. All right, so unfortunately for treatment, there is no cure for CF, but there's some treatment plans that help manage the symptoms and improve the quality of life. So when patients with CF go into treatment, there's a couple goals that they want to keep in mind. The first one is to prevent and control infections in the lungs. And then the second one is removing and loosening that mucus from the lungs. The third is treating and preventing intestinal blockage. And the fourth and final is always to find a way to provide nutritious meals. And then lastly, we have medications. So there is no treat or cure, there are medications that help. And the first one is antibiotics. So the antibiotics treat and prevent lung infections. Anti-inflammatory, those medications are used to loosen swelling in the airways in your lungs. And then mucus thinning drugs such as saline is to help you cough up the mucus, which can improve lung function. And then bronchodilators, that is used to help keep your airways open by relaxing the muscles around your bronchial tubes. And then oral pancreatic enzymes is to help you digestive system, my bad. It helps you absorb the nutrients. And then lastly, we have the stool softener, and that is just to help prevent constipation or bowel obstruction.
Okay, so this slide focuses on the complications, specifically respiratory system complications of people who have cystic fibrosis. So the first possible complication is damaged airways. And cystic fibrosis may cause a chronic lung condition that causes abnormal widening and scarring of the airways. And then the damage to the airways makes it more difficult to move air in and out of the lungs and breathe. And also it makes it difficult to clear mucus from the bronchial tubes. The second complication is chronic infections. So the thick mucus that cystic fibrosis patients have in their lungs and sinuses creates an ideal breeding ground for bacteria and fungi, as Emma was talking about with the antibiotics. So this causes frequent sinus infections, bronchitis, pneumonia, just more commonly in people with cystic fibrosis than those with not. And then another complication is respiratory failure. So commonly over time, people with CF may have damage to their lung tissue to a point where it no longer works and serves its function. So this causes lung function to worsen gradually, and then eventually it can become life-threatening. And then these are the complications that cystic fibrosis causes on the digestive system. So like Caitlin said, there's nutritional deficiencies is common in children with CF. So delayed growth, weight loss, inflammation of the pancreas. These are all effects of that thick mucus that blocks digestive enzymes from the pancreas to the intestines. So the CF patients aren't getting the nutritional value from the foods they eat. The next thing is diabetes. So CF increases the risk of diabetes because that thick mucus causes scarring on the pancreas, and this prevents the pancreas from producing normal amounts of insulin. So diabetes is way more common in CF patients than non-CF patients. And then lastly, we have liver disease. So the tube that carries bile to the gallbladder and the small intestine may become blocked or inflamed because of that thick mucus in people with CF. So this can result in several liver problems such as jaundice, fatty liver disease, or cirrhosis of the liver. And this picture right here just shows the liver. And then next we have relevant information. So patients with CF should not be close to each other because this puts them at greater risk for getting and spreading dangerous germs and bacteria, as they're more commonly susceptible to this bacteria. And then cystic fibrosis can also take a toll on mental health. So it's important to understand that dealing with a chronic illness that has no cure can cause fear, depression, anxiety. And then individuals with close relatives who have cystic fibrosis can get genetically tested to determine the risk of having a child that might have cystic fibrosis. And then this picture just shows how cystic fibrosis can spread down through the family depending on if the parents carry it or they're potential carriers, or yeah. And then these are our sources.